Hello everyone, this is a slideshow that will help you to understand how to take a history from a patient with a breast condition. This slideshow is presented by the GS Clinic Education and it will be introduced by me, Dr. Saif Al-Sahi, and I hope that it will help you a lot in taking history from a breast patient with a breast condition. So first of all, and before we go through this slideshow, I want you to focus on the following points because mostly these points will be basics of all history. Like whenever you take a history from any patients, you need to follow these steps. So many students ask me, when I take history, shall I do that? When I take history, shall I do that? Here I'm going to tell you the things that you have to do in every history you take from any patient. These are the steps that, let's say, are fixed to each history from any patient, regardless of the grade the student is or the topic the history is about. So you have to follow these rules. So whenever you take a history from a patient, you have to stand on the right side. Whenever you stand on the left side, here you're going to make a fatal mistake and whatever you do other than that, you will give a bad impression to the examiner, and maybe this will affect your mark highly. So first of all, whenever you take any history from any patient, the first thing to do after you stand on the right side is to identify yourself. Let's say I'm Dr. Saif, a stagiaire student, or I'm Dr. Saif, a fourth year grade student, or whatever your identity or your title is. The first thing is the patient have to know who's the person who is talking to him, especially if it's the first time. After that, you have to confirm that you're talking to the correct patient. Like you ask the patient, what's your name and age, please, so you can know that you are talking with the exact patient your assignment is. So you say, what's your name? He will answer you as simple as that. My name is Mr. X and my age is X, and so on. So you have to ask each patient, first of all, after you identify yourself, what is your name and age. After that, it's logically to tell the patient what's the purpose of this meeting. Like, I'm not going to say, what is your complaint? So I'm a student and I'm talking to a patient that I never seen before. So the first thing to do is to ask the patient, or to tell the patient, I'm going to take a history according to blah 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 blah. I have an exam today and I'm going to take a history. I'm a student and I have assignment to take a history of breast disease, and I'm going to take a history from you. And you have to tell the patient the exact reason that you are talking to him. This is the first step. After that, you gain consent. Like, when you tell him the purpose, I'm Dr. Saif, a medical student, and I have been told to take a history from you regarding your medical condition. Is that okay for you? So, is that okay for you? And it is a verbal consent. And after he say yes, it's okay. You go on and continue what you have started before. So be sure that the patient is comfortable and it's illogic, or let's say it's unreasonable to take history from a patient who is in pain, or take a history from a patient who is sleepy, or take a history from someone who is unwilling to tell information. So you have to be sure, like, this is not an ask a question. Just if you feel the patient is not good, you can ask him, are you okay? Can you talk now? So it will be more comfortable for the patient and he will say, yes, go on. So another thing that is important in every history you take is to give the patient time to answer, especially if the examiner is standing beside you when you take the history. Don't rush. Don't do you have pain? And then ask another question, and ask the third question, and give the patient time. And especially if the answer is something that is bad to the patient, give him time. to digest that. Like, what is your complaint? Well, I have breast cancer. And then you say, when did the breast cancer start? It's not, it's wrong to do that. You have to give him time and say, oh, I'm sorry for that, or I'm really sad to hear that, or show him, let what we call it, empathy, and don't answer very shoot questions. You have to wait for the patient to answer, and when the patient answer, if there is something bad, you can go and say, oh, I'm sorry to hear that, it's really difficult for you, I hope that everything will be okay, things like that. And something else is never ask two questions at the same time. This is very bad idea. Like when I ask you, when did you have the pain for the first time, and how long does the pain stay each time it comes? This is a complex question, and you need to ask each question separately. Okay, don't use two. Now we're going to talk specifically about the breast history. So, there are two types of histories that you can take from a patient with a breast condition. So, if you are in an OCSE station and let's say a short history taking, you have to be up to the point, and you don't have enough time to take all the information you need about the patient. On the opposite, if you are asked to take a long history, you have to take all the details of the patient. You have enough time, and the examiner wants all the details about the patient in specific, but the information that is relevant. You don't need to say everything, because if you're going to say everything, you need 3 to 4 hours. But you need to pick up the most relevant information and the informations that are related to the patient's condition, and will later on affect our treatment, our investigations, our diagnosis, and the plan later on for the patient. So if we're going to take an OSCE, just enough to ask about the patient's name and age. But if you're going to take a long history, add to that the occupation of the patient. These are examples. If I'm going to take an OSCE station, I'm going to say Alia Ahsian, a 24-year-old, sorry here, female, not male. So I'm going to say Alia Ahsian, a 24-year-old female, or Sarah Nader, a 55-year-old female. So you say it in that, not the patient name is. I'm going to talk about this in detail in the last slide. So just have an example. Whenever you have the patient, you say the name and the age directly. If it's a long history, you can say Layla Ali, a 35-year-old teacher. She is married and lives in Baghdad. These are the detailed information about her. So you are specifying the patient, the name, the age, the occupation, the address, and the marital state. These are the identity of the patient. Now we're going to take about the chief complaint, and it is the main problem that brought the patient to the doctor. The patient might have many problems, and usually our patients have many complaints, but you have to focus on the complaint that brought him to the hospital. Maybe he has problems that have been lasting for, let's say, 1 year, 2 years, and some patients for a long time. But the main complaint, or the chief complaint, is the problem that brought him to the hospital now, and bring him under medical attention. So what's important about this is to ask an open question. And what I mean by open question is the question that doesn't have a specific answer. Like when I tell you, how are you today? This is an open question, because you're going to say many things. There are many answers for this question, and you can talk for 2 hours about this question. But when I ask you, did you eat fish today? This is a closed question. The answer is either yes or no. So in the chief complaint, you have to ask a open question, so the patient can choose the best answer for him, and he will say, like let's say, what Hello, Mrs. Alia. What is the problem that brought you to the hospital? So this is an open question. She will talk about her complaint that brought her to hospital. So, but if I ask her, do you have pain? She can answer yes or no. Another most important thing about the chief complaint that mainly the main problems in the breast conditions are pain, which we call it mastalgia. Pain in the breast is called mastalgia, which can be either cyclical or non-cyclical, which we mean by cyclical and non-cyclical. The pain that is related to the cycle, the female tell you that I have a specific time in the month that the pain is increasing. And otherwise the non-cyclical, she say no, there is no specific time and I always have that pain. Or it might be a mass in the breast, or it might be a nipple discharge. So the nipple discharge might be from one side, two sides, single duct, multiple ducts, and these are the main complaints of a patient with a breast condition: discharge, mass, or pain. I don't think you will find another complaint. Mostly these are the complaints of the patient. And what is very important here is to put the duration of the complaint. You never say the patient have breast pain or mastalgia and that's it. You have to say mastalgia for, nipple discharge for, let's say 2 months, 1 month, and so on. Now we have examples about the chief complaint. And what's important to know, never add details in the chief complaint. See, these are examples. Right breast mass for 2 month duration. Mastalgia bilateral for one year duration. Bloody nipple discharge for 2 weeks duration. So the chief complaint is just like a topic of any article. You put the main idea and the duration in one sentence that is very short and give a hit up to the point. Now we're going to go to the next part of the history, which is the history of present illness. And in this part, we're going to talk about the details of the chief complaint. It's just we are going to go through the chief complaint in more and more details. One of the most important complaints of patient with a breast disease is the mass. So, how can you ask about a breast mass is as similar to any mass in the body. The first question will, when did you first notice this mass? And the patient will ask you 1 month, 2 months, 2 years, 5 days, 3 days, whatever the answer is. It's just simple, close the question and it will have one answer. After that, you can ask him, how did this mass change since you discovered it? Like when you have a mass, it will change. Either it will stay the same size or it will decrease, increase, or it will fluctuate, like increase or decrease with cycle or whatever the change will be according to the patient's answer. Then you can ask him, is there any other masses? Like, did you see or notice any other mass? And here we're talking specifically about the axilla, the other breast, and other site in the breast. So the patient will answer, yes, I noticed a mass in the axilla, I noticed a mass in the other breast, or I noticed a mass in the same breast, or he will say that I didn't notice any mass. The next question is, did it ever happen before? Like if you're going to ask him, did you have this mass before? Did it happen and disappear? Some patients will answer you like, yes, this mass, I noticed this mass like this one 3 years ago, but it disappeared spontaneously. Or he will ask, I did a biopsy for it, or whatever the answer is. And some patients say, no, this is the first time I have such a mass. The most important question, which may be specific to a mass in the breast, is it related to the cycle? Does it increase, decrease with the cycle? Or it's not related to the cycle? This is a very important question you have to ask any patient with a breast mass. Things that are also very important to ask is the condition of the overlying skin. Is there redness? Is there tethering? Is there any dimpling? Is there any discharge? Whatever the condition of the overlying skin, it has to be mentioned in the history. And associated conditions, and there are many associated conditions. One of them are the pain, fever, weight loss, whatever the associated symptom is, you have to mention it in the history of present illness. We have an example here, like we're going to go through the mass of a patient. The patient has right side. Please don't try to go like a robot saying sentence. You have to say it like a paragraph, so the examiner will listen and follow you, like he is let's say will stay focused on the information you are giving. The patient has right side breast mass in the upper lateral quadrant. Don't stop, continue like that. The patient has right side breast mass in the upper lateral quadrant. She noticed it accidentally during self-examination 2 months ago. She didn't notice any other masses and reported no previous history of mass. The mass size is not related to the cycle and the overlying skin is normal. So I didn't say the patient has right breast mass. The patient found it in the upper lateral quadrant. The patient, she not, like, no, it's as a story. Smooth as a story. All the information as a story. You put it in an coherent consequence, so the examiner can follow smoothly, and he will give you a very, very good mark if you do that. The second most important complaint is pain, and sometimes you find a patient with a mass and pain at the same time. So what are we going to do? We're going to ask the patient, what brought you? Sometimes patients say that it is the pain and the related is the mass, and sometimes the mass and the related is the pain. So you start from the main complaint of the patient and consider the other to be the related presentation. Pain is as the classical Socrates consequence. We asked about the site. Where is the pain? The onset and the duration. Is it sudden or gradual? Is it character of the pain? Is it sharp, dull, burning? Whatever the patient tell you about the character of the pain. Does it go anywhere else? We call it radiation. Or is it fixed in that point? Is there any associated symptom with the pain? Fever, weight loss, vomiting, anorexia, bone pain. Things related to the pain. And time course. What I mean by time course, it is improving, increasing, on and off, most at night, most in the morning. When is the patient the most? What time of the day is the patient the most? And is it increasing or decreasing? Are there any exacerbating or relieving factor? Like if the patient say, when I touch it, or the patient say it's increased with cycle, or the patient say it's released by medication, when it is released by a hot sponge, or whatever the aggravating or releasing factor is. And the severity, well, actually in our region it's difficult to ask this question because most of the patients will not give you the satisfying answer. But here we can use another approach, is to say, does it affect your daily activity? Like if he's an employee and don't go to work, so it is severe pain that prevent him from going. If it prevent him from sleeping, prevent him from doing his daily activity, this is definitely a severe pain. But if the pain doesn't prevent him from doing daily activity, he go out, go shopping, do his daily activity, so this is definitely a mild pain. Another example here, and I will say it in the proper way you should tell the examiner, like that. The patient has been presented for 2 months. It is in the left upper side of the breast, started suddenly, is dull in nature. The pain does not radiate, and there is no exacerbating or relieving factor. The pain is 6 out of 10 in pain scale and has been gradually increasing. So you don't break it up into many sentences that is boring, and the listener or the examiner will be bored following your sentences. You say it as a story, and in the sequence, and in the best let's say way to give the information, or how to translate the information to the examiner so he can understand what is happening to the patient and give you a good score. The third and most important presentation of any patient with a breast condition is the discharge. And nipple discharge is, here we have to say it's nipple problem and not the nipple discharge alone. So what's happened to the nipple? Is there any change? Is there any nipple inversion? Does it went inside in the breast, or is there any deviation, like change in its position? Any discoloration, like there is any change in the color of the nipple, redness, discoloration, darkening, or any distortion? Is there any eczema-like lesion, any like ulceration, any distortion that happened in the breast? We have to ask this question. Next, we have to ask about the discharge. Is there any discharge? Is this discharge from single duct or from multiple ducts? Is this discharge unilateral or from both breasts? Does it go out spontaneously, or is it induced? Like the patients say, I put a tissue paper under my bra and I find the discharge on the tissue paper. Other patients say, no, I have to squeeze the nipple to induce the discharge to go out. These are different and have a different pathology and very important information. The amount of the discharge, some patients have just drops, some patients have a large amount of discharge. And this is very important to say. The color of the discharge is very, very important, because it might give a hint to the underlying pathology. So the color of the discharge is very, very important. Associated with it as fever and other presentations are very important, because it might be caused by infection. So we have to say if there's any associated like fever. And here I have to tell you that sometimes you have 3 complaints in a single patient, sometimes only one of them. So just be careful to put the main complaint at the beginning and then the associated with them, whatever or how or regardless of the complaints of the patient are. So you put them and give details of each complaint accordingly. After that, and before we finish the history of present illness, we have to take a review of system. Here I just want to mention that it's illogical, or it's a bad habit to mention everything. Here what I want to do is, in the review of system, I want to look for malignancy, or let's say metastasis. So there are important points in the review of system that might help me. Like if there is any cough and dyspnea, I'm thinking about metastasis to the lung. Headache, I'm thinking about metastasis to the brain. Bone pain, I'm thinking about metastasis to the bone. And all these are related to the breast. And it's illogical to go through everything and to say everything. These are important positive, and don't mention the negative, because they are not important negative. Just these are the important positive. Okay. After that, we'll go through the gynecology and obstetric history, the past medical history, and the past surgical history. The gynecological history is very, very important in any patient with a breast condition. It's very important to ask the age of menarche. You have to copy these on heart, and you have to ask them the age of menarche and menopause if the patient is post-menopause. The regularity of the cycle, the parity, how many children does she have, and at which age did she have the first child. This is very important information, and you have to ask them in specifically, let's say. Did she breastfeed her babies, and for how long did she breastfeed them? This is very important in a case of breast compliant. In the past medical history, any chronic illness she has, you have to mention. But what is specific here is other malignancy, like in the other breast or in other site, like ovarian cancer or abdominal wall, because it might be a part of a syndrome. And as I said, any chronic illness has to be mentioned in the past medical history. Past surgical history, specifically about the breast biopsy or any breast surgery if she had before. And family history is very important, specifically for the first degree and second degree relatives. If any of them had a breast condition or any of them had a malignancy, even if it's not a breast malignancy, it might be another malignancy, but it's also important because they might be related to their breast condition. The social history, most of our females are not smoker or drinker, but you can ask about smoking these days because it's increasing female number that who are smoking. So you can just ask about smoking. And drug and allergy. In the drug history, it's important to ask about hormonal therapy because it might be related to hormonal therapy or contraceptive pills, because we said that most of the breast conditions are related to the hormonal influence on the breast tissue. This is an example how you write the related histories. She had her first menses at 12 years old. It has been regular since then. Alia has 3 children. Her first birth was when she was 21 years old. She didn't breastfeed any of her babies. She doesn't have chronic illnesses, and she had an incisional biopsy for a lump from the left breast, which result showed it's a fibroadenoma. Her family history was negative for significant diseases, and she is a smoker, 1 packet per week. Alia didn't mention any chronic medication, use of chronic medication, or hormonal or contraceptive pills. She reported no drug allergies. So you don't say, like most of the students say in the boring way, but medical history was blah blah blah, past surgical history was blah blah blah, past drug history. No, you don't say that. You say it all mixed together, but when you take the information, you take them separately, and when you summarize your case, you say it in that way. That will be very, very impressing, and will give the examiner a good impression about how you take the information and how you arrange them in a very nice. And finally, you have to thank the patient. This is very important, specifically or when the examiner is standing beside, because he will put a high grade on this, high mark on this point. And after that, summarize the case. Here I want to mention that most of the patients say, like, how can I summarize the case? As I said previously, you put it as a story. You don't say patient's name. No, you put it as a story. Alia is 21-year old, married, she has children. Put them as paragraphs. And when you want to transmit from one paragraph to another, just put a small pause. Like when you finished, Alia, 25-year-old female. Stop. Then you say, she presented with chest or mastalgia for 2 months. You stop. Then you start again. Alia presented with right breast and full present history of present illness, and then you stop. Then you give the past medical surgical allergy all together, and then stop, and then you say I want to send the patient for diagnosis, and I want to send the patient for investigation if the examiner is going to ask you. And most of the time, the history station will end up to this level. So I hope that you all had benefit from this presentation. It's a matter of practice. When you take about 5 to 10 histories of about different breast condition, trust me, you will master this station, and you will get a high score, because it will be like you'll be fluent in this station, and I'm sure you'll get a good mark. I'll be happy to get review from you, and I hope to see you again in another slide presentation. Thank you for being with me. I'm Dr. Saif. Thank you very much. And I hope to see you on the JS Clinic Education. And you can contact us if you need anything or you want us to do a specific video about any surgical topic. I will be happy to hear from you. Thank you very much to all of you.